Good morning. Well, today's the day. Just wanted to give another update. Just got to the clinic, got clean shaven and ready to go for a couple days without making it upstairs to my bathroom. Anyway, I was hoping that I'd have time to get a video done last night, the night before, but didn't quite have the time. So here's my attempt, a little bit too late, but I'm not gonna lie, last night I was a little bit nervous about the procedure today. Had a lot of things going through my mind, like, what could go wrong? What if something does go wrong? Thinking about my wife and my kids, and thinking about getting back to work, and just hoping that the recovery isn't too long or too painful that it inhibits my plans. Concerned about the pain from the harvest because I'm gonna have just some light oral sedation for that portion of it. And I kept thinking back. I remember when I was playing sports, when there was a pressure situation, I was always taught to think that about all the other times that you've done it. If you have a free throw with a second left to win the game, think about the thousands and thousands of free throws that you've shot in practice and in other points in the game. This is just another free throw. Just take it and make it like you always do. And so that helped assuage me a little bit. But one of the interesting things is being somebody who's been on the other side and who's performed these procedures and who's assisted on hundreds of these procedures. I know what it looks like. I know exactly what to expect, but I just don't know what it feels like personally to have it done yet. And from the way it looks and from the mechanism of how it happens, it's a little bit brutal. And knowing that, I think, makes it a little bit harder for me to just kind of relax about it. So I definitely worked on some of my deep breathing and mindfulness and concentrating on the good things. And really, what it comes down to is, heaven forbid if something were to happen that was a complication or untoward, there's really nothing permanent that is going to happen. I mean, the worst of what could happen are mostly transient things like an infection or severe pain that lasts for a while, or those are kind of the main two things. Otherwise, I mean, Dr. Desai has done this so many times. I've seen him do it so many times. I've assisted him doing it so many times. Those are the two main risks. I mean, sure, people can have some hematomas and things like that, but everything that could go wrong can pass. Now, that's quite a bit different than a surgery. Things that can go wrong in surgery, those things might be permanent. And so just something to keep in mind. But I just wanted to document the fact that if I were to say that I weren't nervous about this, even though I am very confident in it and confident in the skills of the physicians, that I'd be lying. But I think everything is going to be great, and I'm excited to get this done.